My name is Matt Dowd. I'm 35 years old and I've been running for most of my adult life. Running makes me relaxed. I like the feeling of accomplishment. I've done mostly 5 and 10Ks and a half marathon, and I was training for a full marathon but didn't quite make it. I didn't get to complete it because I had a heart attack in my 12th week of the training. When I left the hospital, I needed a lot of mental and physical reconditioning, and that's where clinical exercise physiology came in.
So Matt was very mentally and physically debilitated. He was very hesitant to start any kind of exercise program.
Matt did not physically appear to be an individual who would be in any type of exercise training for a marathon.
You'd almost say, he was pale, very weak, unable to do long-term exercise like a runner would. As clinical exercise physiologists, we serve a high-risk population. So these are patients with a stroke diagnosis, heart attack, heart surgery, a wide variety of diseases that we treat.
So as a clinical exercise physiologist, we're looking at the patient's history in a sense that we want to know the total picture of what's going on from an anatomy and physiology standpoint, because that absolutely dictates our treatment plans and how we help the patient progress.
So we use the approach that exercise is medicine. Clinical exercise physiology is not just personal training, it's a lot more scientific.
So the difference between going to a gym and being under the supervision of monitored exercise is that we're actually monitoring all of his physiological responses and physical activity, and then we're recording that data and we're submitting that back and forth to physicians.
We know about their medications, we know about the effects of those medications on exercise, and those help us develop an exercise prescription that really helps the patients.
Matt needed clinical exercise physiologist because he needed a monitored eye, essentially.
A medically supervised exercise plan benefits Matt and other high-risk patients by giving them strength and endurance to do not only their daily activities, but to really help manage their disease.
We care for people physically, mentally. It's not so cut and dry when people come in as far as what they've had to endure mentally from the disease process. So it's a really individual approach.
We not only teach the patients how to exercise and to get stronger, but we also treat their mind emotionally and mentally, because there's a lot that goes along with their disease. We're not just glorified personal trainers. We actually go to 4 to 6 years of school, and we study these diseases and how they integrate with exercise so that we're able to take care of the whole person.
We specialize in cardiovascular, respiratory, bariatric, psychosocial. The list really goes on.
Matt was like other patients in that he completed his exercise training over about 2 to 3 months. And that really helps him to develop autonomy at home.
Not only did we want him to be increasing his capacity with physical activities, but we wanted that to be in addition to everything that he would typically do on his given day.
And by the end of his exercise program, he was really able to do what his goal said, which was run again.
I'm over 10 months past the heart attack and over 6 months past the heart transplant, and the clinical exercise physiology has gotten me back to where I can run a 5 or a 10K with ease. My life is back to, I would say, 99% normal because of clinical exercise physiology.